Hi viewers, welcome back to this session. This is your host, Dr. Roslyn Odhiambo, on Skills versus the Midwife. And just like you know, we are here to nurture and to make sure that we bring up passionate midwives who are ready to serve the nation at large. Thank you very much once again for joining us, and today we want to do a review of a video that we have done before on monitoring the Partograph. And today we are going to explain actually some of the updates that have actually come up, recommendations that have been given by the WHO, that is the World Health Organization, and we will see how best they can actually impact lives and help us to monitor these women who are in labor. Other than that, I am joined by two guests today who are also going to, give us their experience and give us explanations on how they have actually interacted with the new updates of monitoring the mothers during labor. And they will introduce themselves.
Okay, my name is Eliud Kariri. I'm a student nurse.
Hi viewers, my name is Brian Otieno, a student nurse in Kirinyaga University, year 4 currently.
Thank you very much. Thank you very much, Brian and Eliud, and I'm happy to have you here. And you people have actually monitored mothers in labor. Let's begin from there. So I have students here who have rotated, who have done their rotations in labor ward, and they have actually had first-hand interaction with the Partograph. All of us know what the Partograph is, and I would just like you to refer to the series that I've done on the Partograph. There are 4 series. Just check on Skills versus the Midwife and you'll be able to see the series. But today we are all about the review. Now, maybe to just start off very quickly, let's remind our viewers the importance of the Partograph. Why is the Partograph important?
Okay, firstly, this is a tool that is monitoring both the mother and the fetus. So the importance of it is just to detect any early complications and to intervene early, as well as to check for anything to do with the fetal distress, so that we can monitor, so that we can intervene as early as possible.
Okay, thank you, Eliud. But do you think, Brian, that we can be able to detect complications using the Partograph?
Yeah, sure. A Partograph is not just a paper. It is very important in saving the life of the mother and the child. Complications are easy to detect using the Partograph if it is followed carefully. So it is very important.
We can actually diagnose some of the complications, right? And we see that the Partograph that we've been using, let me put you up to speed. Normally we have an alert line and an active. We have normally 2 lines in the Partograph. Maybe we can just use an illustration here, but like I said, you can always refer. We normally have an alert line and an action line. Now, from the previous Partographs that we've always used, we have the alert line starting from 4 centimeters. Just as a reminder, what is the full, when a woman is fully dilated, she's normally how many centimeters?
10 centimeters.
10 centimeters. So normally when the woman now has to be admitted, we make sure that she's in active phase of labor. Now, active phase of labor used to be, from the Partograph, 4 centimeters. But now we are having an update. What is the update, Brian? What is this update we are having today?
The update is in the back we were starting with 4, from 4 the active phase, but now there is an update. We are starting it at 5 centimeters.
Yes. Yeah. And why do you think that is so, Eliud, based on the updates that are coming up?
Okay, so the previously we were starting at 4, and some of the nurses, the midwives, were making the wrong interventions, were making early interventions, which should not be the case. So the current one is starting at 5, so that we can avoid these early interventions.
Okay.
So that we can monitor and see the progress of the mother.
Very true. Thank you, Eliud, for putting it like that. Now, you see, most of the time we end up diagnosing the mother wrongly. When we start intervening early, we end up diagnosing the mother to have complications like prolonged labor. When we start intervening, for example, giving medications like the oxytocin, we want the mother to, labor very fast and to, push the baby very fast. By the time we are intervening and, taking action before the mother is in active phase of labor, we end up with wrong diagnosis. So that is the major reason why this update was put across. Now, there are most facilities right now that are still utilizing the 4 centimeter partogram, but now we are here to enlighten us. Look at these students. They already know how to use the latest partogram, and they are having that experience, and it is working for them. And I would like to ask them, how is it monitoring the partogram? How is the experience like monitoring the partogram? Is it hard, the way I hear most people say, this thing is so tedious, we don't even have time, you know, we are busy. How has it been for you, monitoring the partogram?
No, it has not been that difficult,
yes.
But for the first time users, you can experience some challenges. Yeah, with the time, we have like the fetal heart rates, you might confuse monitoring them at 1 hour maybe. But after doing our practice, so what I encourage others who are watching us is that we continue practicing this. The practice makes us perfect. So it has not been difficult to us because we have done.
Okay, thank you very much, Ellie. Then I'm glad to hear that you are actually doing well. And any student who is watching us out there today, please, you can also do it. Now, Brian, tell us, is there any other part of this partograph that we are monitoring differently? For example, the maternal parameters, fetal parameters, apart from the one that we are talking about, we are starting the active phase at 5 centimeter. Is there any, or you can just assure us that every other thing is monitored the same way?
Yeah, sure. Most of the things are going to be monitored the same way, but care, there is a lot of care that is needed to be improved on.
Yes.
Yeah, and attention.
Yes.
Yeah.
Thank you, Brad. Thank you, Brad. And coming to that, there's a lot more that needs to be done. I have a document here that is written Introduction to the Whole Labor Care Guide, and this tool is for implementing recommendations on intrapartum care for women. Now, the WHO is coming out with something new, and it is making recommendations on how better we can provide essential intrapartum care. And that means then we are going to very soon, this is now the next generation, tool that will be used to monitor the women, whereby we are using the labor care guide. Now, some of the other things that Brian had just started mentioning, the additional will be, for example, supportive care to the mother. So you need to be there with the mother. For example, in the first stage of labor, what are those? Just mention 2 or 3 that you give to the mother as care. First stage of labor, so that we can give them support. Just give me 2 or 3.
Yeah. So one of the things that we have to give to the mother is comfort of the mother.
Yes.
We have to ensure that the mother is comfortable. Yeah, we have also to encourage the mother, give her health messages, yeah, even in labor, so that she can cope very, very nice. Yeah, those are some of the things that we have to take care of. Yeah.
Yes, yes, Elliot. Any other?
Any other? Apart from that, we also encourage the mother to keep hydrating so that she can be energized during the second stage of labor, so that she cannot run out of energy during second stage of labor. That is wow, actually.
Very, very true. The mother has to eat. There are women who go into labor and suddenly they faint on the couch. We want the baby to come out and then they faint on the couch. They have to eat. They have to ambulate, moving, so that at least we can have proper descent taking place. So there is a lot of supportive care. Anxiety, please calm the mother down. Tell them it is okay. So support has been emphasized in the new recommended labor care guide by the WHO. Secondly, the care of the baby. And actually we can have comparison. There is nothing so different about the labor care guide and the new partogram that is starting from 5 centimeters active phase of labor. Like, for example, let's look at, there's another aspect here, care of the woman. Here is where we are monitoring things like what?
The care of the woman,
yes.
Will be monitoring the blood pressures, the temperature, we also monitor the respirations, the urine output.
Yes, the vital signs are very important, yes, including even the contractions, yes. How do we know that the mother is almost pushing if we are not monitoring the contractions? So that is very important. Then another aspect is on medication. Are there medications we need to give to this woman? No much difference from the previous partogram. We are just emphasizing that every action we are taking should be geared to the mother. And that is why we are saying, number 1, personalized care. Each and every woman is different. Brian, do you think my labor will be similar to someone else? No. In fact, from your experience, how have you seen it?
Yeah, the different mothers experience labor differently. Some of them are easy to, they cope with the labor very easy and they are very strong. Some of them, the mechanism of coping for them is very difficult because of some of the mothers experience contraction, very strong contraction.
Yes,
others,
like that.
the contraction cannot even be able to fasten the labor, so they need even induction. So the experience is totally different.
It's totally, I like what Brian is saying, because you know what you're trying to explain. Like me, I'm a noisemaker. In labor ward, trust me, you will just get me everywhere. So there are those whose pain threshold are quite high. So they can actually do what? Tolerate the pain. But there are others who it's quite low, like me. I confess I am one of them. So one of the principles is personalized care, and also we have that we need these healthcare providers, just like you are upcoming midwives very soon. You need to be able to minimize interventions as much as possible. And every action you take should be beneficial to the mother. So bearing in mind those principles, I would like to emphasize today, part of our review is this. Number one, our update, partogram. You can go to remote areas, and actually this is still being rolled out. There are facilities, I think Brian still don't have this one.
Yeah.
The 5 centimeter partogram, but today we are saying that we are moving. Each and every day, our management and the processes and the different levels of care actually improve. And today we are here to say that yes, we are now using the 5 centimeter partogram, but in some facilities that are way advanced, they are already rolling out the labor care guide. So for us today, we are saying, yes, look at your fellow students, they are doing it. And we are here to just say that you can also do it. Maybe a parting shot from my 2 guests today. What do you want to tell the viewers, especially those fellow students who are watching it today? Yes.
Okay, the fellow viewers, the fellow students, I'd like to encourage you so that you can at least move from the 4 centimeter one, so that we can move to the 5 centimeter one, so that we can minimize the early interventions, and as well keep practicing. The Partograph is very easy. You can go to the YouTube channel, Skills versus Midwife, and watch. She has done now.
Thank you, and thank you so much. Brian?
Yeah, also on my side, one of the things I really like in the hospital is caring for the mothers. They are very special people in this generation, and we have to care for the mothers and the children or the babies. So one of the things I encourage my fellow students is that let us not take shortcuts. Let us not assume and go and just chart the Partograph from our own aspect and our own, like just gazing and coming to this. I encourage total integrity so that we can avoid maternal death. Mothers are very important to us. And I encourage you also to take a line of midwifery. It is very interesting. Yeah.
Very true. Thank you, Eliud. Thank you, Brian. And from me to you is that, number one, I want to encourage you to go and watch the previous series. Number two, I will do another series where I'll be talking about the labor care guide purely, so that you can be able to enhance your knowledge and skills. And number three, remember, Skills versus the Midwife is here to nurture your professionalism, your passion in midwifery as you care for those patients and leave a legacy for the future generation. From me to you, goodbye. See you in the next video.